Joining Representative Hagedorn is Peter Pitts and American Conservative Union Executive Director Dan Schneider for Keeping Your Healthcare Yours.
So I live in the swamp in the Washington, D.C. area, and there are some real experts who are relied upon, and that's...
I don't know.
Peter, I just heard the congressman talk about the value of free markets in healthcare. But isn't socialism really the right way? That's supposed to be a softball to you. Isn't socialism the right way for our healthcare system to work? What's wrong with socialism?
Do we have another 2 hours? Hi, Minnesota. Nice to be here. How many of you have read The Conscience of a Conservative? Go out and read it again, because the reason socialism doesn't work is because it has no conscience. It doesn't recognize that each of us are individuals, and that's across the whole domain of our lives, and especially in healthcare. At CPAC in Washington in February, we had a panel on this, and we had an Austrian economist who said to me, "Why are you so aggressively trying to make the same mistakes that we've made?" You know, all you need to do is look at socialist countries to understand what doesn't work. What doesn't work is you can't get access to the care that you need at the point in time when you need it. That's measured in lives, period. It costs more. It isn't efficient. It stifles innovation. You know, 20 years ago, all the great medical innovations came from Europe. No more. Now they all come from the US, and that's not an accident. Socialism does not reward independent, smart, aggressive risk takers, and our society does. And the people that say we need to be more like Europe are either just incredibly stupid, or they have some agenda that I simply cannot fathom, and that is power. They want power, you want health. It's not a hard choice.
So Congressman Hagedorn, you and I have actually talked about this a little bit, you know, the European model and free markets. I would like to hear what you have to say to Peter.
Yeah, I think Peter's right, and I'll give you an example. So when I was diagnosed 20 months ago, you talk about surprise billing. Well, this was a surprise diagnosis, right? I had no idea I had kidney cancer, and that had spread a little bit. And luckily, within about just at that very time, a new regimen of drugs was approved by the FDA and allowed for somebody like me be treated. 2, 3, 4 years ago, there was nothing really, and it was pretty much a death sentence. So they give me these immunotherapy drugs to help my body rev up the immune system and go attack the cancer, and then another drug, and that regimen of drugs can be very expensive, of course. But I always say the most expensive one is the drug that's not available because you don't have it. Anyway, in Great Britain at this time, they looked at it and they said it was too expensive. Said that the people that were on their socialized system over in Great Britain, that they wouldn't have access to the therapy that I have, and that is saving my life. And I don't know how you put a value on it.
I want to just make sure everybody heard that. In Great Britain and in most of the European countries and Asian countries, what does it mean when those governments tell the people, sorry, the drug is too expensive?
In many cases, it's a death sentence.
But they couch it. They don't say it's too expensive. They say it's not effective enough. It's not better enough than the existing therapies. Really, ladies and gentlemen, is 5 years additional lifetime really worth that expense? Of course it is.
It's a cost-benefit thing. You're right. And then, of course, if you're starting new therapy and you're putting this out into patients, you don't have the data to show that it's going to work enough or whatever to justify it.
And people should have the choice to make. If they want to spend more money to get the care that their wife or husband or kid or mom and dad need, they should have the right to do that. And in most European countries, they don't. They cannot go outside of their own system. So there's a total lack of choice. The government becomes your doctor. We were talking about this earlier. The government overrules the decision that your physician makes.
Well, Peter,
think about that.
Peter, you talk about your physician. I want to switch a little bit and talk about different kinds of delivery systems for health care. The Democrats like to talk about Obamacare and health coverage. Of course, coverage isn't care. We can just wave a magic wand and say, oh, everybody's covered. It doesn't mean anybody's getting health care. There's a way to get health care without even having formal insurance. Various health sharing ministries. What is a health sharing ministry? How does that work?
Do any of you here belong to a health sharing ministry? Me too.
Good.
Basically, what a health sharing ministry does, it's not insurance. It's a basic core American value of neighbors helping neighbor and sharing in everybody else's expenses. This administration has been very friendly to that concept, that we all don't need to have private insurance. We all don't need to have government insurance, which is clearly what a lot of people think we do need. A lot of people have health sharing because that's what their faith tells them to do. It rewards exercise and diet and not smoking and doing the right thing and being a part of the community. Under an alternative administration, I don't really want to speak the name, that's going to go away. It's going to be written out of the federal code. So when people tell you they've got a health care plan, what that health care plan really means is doing away with everything except government insurance, including the health sharing that you can get through ministries in your church. So think about that.
Yeah, now these are formalized structures. I mean, frankly, it feels just like insurance, right? If you have to go see your doctor, you submit the claim, and there's a formalized system where everything is covered. But that is a choice. People can make a choice to get your typical health insurance or get health sharing ministry coverage. You were talking about choices,
Yeah.
you know, for
National.
prescriptions.
Mm-hmm. Well, national competition. I mean, I think we should open it up, and people will come up with some great ideas, and some of them will work and some of them won't, but the consumers will figure it out. But this top-down government approach that the Democrats have with Obamacare, that they want to expand it, that's not going to help us in these areas. It's not going to give people the choice. I mean, they said, keep your doctor, keep your plan, save $2,500 a year. If it only cost $2,500 extra a year, most people would be happy. And they're the ones that tell us they have these bright ideas. I don't see it.
In 2001, I was one of the people who designed the Part D drug benefit for Medicare. I don't know how many of you are using that right now. It's a wonderful thing, in my opinion. And Nancy Pelosi and the Democrats said, what? Seniors couldn't possibly make these choices for themselves. We're going to run, that's going to be the thing we're going to run against. Of course, when the election came around and there was 95% approval ratings for the Medicare Part D benefit, they changed their tune. They don't think any of you, not one, can make a smart decision when it comes to your health care. Not a single one of you.
I've got two quick questions for all of you. When Obamacare was passed, you were all promised that you'd be able to keep your doctor and your premiums would go down. Raise your hand, and this is honestly, okay, be honest. How many of you saw your premiums go down? No, honestly, anybody. Did anybody? It's not a bad thing if your premiums went down. Anybody. Okay, how many saw your premiums go up? Congressman, what do we do about this? What do we do? What is the future of healthcare if Joe Biden is elected? What's the future if we keep free market principles?
It's a stark difference. I mean, we know that this is the most consequential election in our lifetimes, and we're either going to have transformational socialism across the board, this is one area, and they're really going to put at risk not just our lives and lifestyle, but our country itself. So these are the types of things we're fighting for, to make sure that we do have competition, free market principles. One thing we haven't spoken about, though, is Nancy Pelosi's bill, H.R. 3. You've seen a lot of commercials on TV against myself and others saying we voted against a bill that would lower prescription drugs. What the Democrats forget to tell you is the type of cost controls that they had in that drug bill would actually lead to between 50 and 100 new cures not going to market over the next decade. Now, everybody in this room knows at least one person, me, who's alive today because of a new cure that hit the market in the last decade. And every one of us knows at least one person who, if they were diagnosed with a disease that they had that killed them decades ago, if they were diagnosed today, they'd live a full life and not die from that, probably something else. That's why we can never allow the government and these liberals get in the way between innovation, technology, and all that's right with America.
If you walk out of here remembering nothing else, remember this. Medicare for all means medicines for none. And don't kid yourself, that's going to happen, and we will hurt, and people will die, and innovation will go away. And considering where we are right now with COVID-19 and the astounding discoveries and developments of medicines to help control and cure it in a very short period of time. That's not happening in Europe. It's happening here, and there's a reason for that, which is competition.
Congressman, last words.
I agree. We just have to protect what we have and keep allowing the free market and all the innovation in the United States work. We're actually helping the world. We're healing the world right now. And in our district in southern Minnesota, I just let my folks know, I will always protect world-class medical care and our way of life in southern Minnesota. Thank you for the opportunity.
Thank you all so much.